Hello, welcome. My name is Susan Gunn. I am the director of the Maryknoll Office for Global Concerns. My colleague Chloe Noel and I are coming to you today from our respective homes in Washington, D.C. And even while we're working from home during a pandemic, we from the Office for Global Concerns continue to represent the three branches of the Maryknoll mission. That's the Maryknoll Sisters, Fathers and Brothers, and the lay missioners. And we work closely with the Maryknoll affiliates. Our job is to bring the Maryknoll mission experience to important debates about public policy at the UN, on Capitol Hill, to the World Bank, IMF, WTO, and the corporate world. Our mission is to speak with policymakers and promote peace, social justice, and integrity of creation. We do this through education, advocacy, and action. In just the last few weeks, Chloe and I have written letters to and joined virtual meetings with members of Congress. We've led virtual public witness. Most recently, it was the Good Friday Economic and Ecological Way of the Cross. And you can see a video recording of that on our YouTube channel. And today, we're going to offer some education, and this time about the urgent need to boost access to COVID-19 vaccines worldwide. I'm so excited to have Chloe present today because she's the leading thinker on US policy on trade and environmental issues for Maryknoll. Chloe's experience living in Ecuador, Bolivia, and Colombia, her bachelor degree in environmental studies and Hispanic studies from Mills College, and master degree in Latin American studies from the University of Texas in Austin, plus her 6 years with the Maryknoll office as our Faith, Economy, and Ecology program coordinator. All of that makes Chloe just the right person to strengthen the voice of the US Catholic community in the debate on United States policy about global access to vaccines. Well, while Chloe talks to us, I want to invite you all to type questions for her in the Zoom Q&A and in the chat box on YouTube. And with that, I turn it over to you, Chloe.
Wonderful. I'm so glad to be with you, and Easter blessings to everyone. I'm going to go ahead and share my screen and we'll have a nice discussion afterwards.
Welcome on World Health Day and in this Easter season, as we see hope for an end to the global health pandemic with the new vaccines. But the pandemic will only end if every person on the planet has equitable access to the vaccine. Today we will explore both the challenges and opportunities to reach this goal. The UNDP, the UN Development Programme, estimates global human development, a combination of education, health, and living standards, could fall for the first time since 1990, when measurements began. Today, we see more than 130 million confirmed cases of COVID-19, and we are fast approaching 3 billion deaths worldwide. Even as vaccination campaigns are beginning to pick up in some places, overall global infection rates are increasing due to variants and less people following guidance on social distancing and mask wearing. We also see economic impacts, especially for essential workers worldwide who are most affected and who have experienced high rates of COVID-19 disease. We know that women in particular are affected as schools remain closed and women are more likely to be caretakers and need to be home with their families. And we know, of course, that for the poorest people on the earth, that work is always essential. There is growing concern about debt as countries try to respond to the multiple challenges brought from the coronavirus. Calls for debt cancellation for developing countries is growing, and the International Monetary Fund just announced that it will provide grants to the 28 poorest countries in the world to cover their debts to the IMF through October 2021. With additional funds from member countries, this could be extended through April 2022. Debt payments to the IMF will be reimbursed through the IMF's Catastrophe Containment and Relief Trust, which can pay for countries' debts in the event of natural disasters and other catastrophes. Developing countries and prominent leaders, including the faith community, have also called for the IMF to approve the release of a special currency from the IMF reserved for these exact kind of economic crises. This currency is made up of 5 different currencies worldwide. The last SDR was awarded in 2008 amidst the financial crisis. For the past year, the U.S. has consistently blocked release of these so-called special drawing rights. But last week, Treasury Secretary Yellen notified Congress that the U.S. will support the release of these reserves up to the $650 billion maximum that the administration can support without congressional approval. These funds will come at no cost to U.S. taxpayers and will bring much-needed economic relief. Even the U.S. will receive some of these funds, but developed countries are encouraged to donate their shares to countries most in need. We have also seen an increase in human rights violations and the closing of civil society space since the beginning of the health pandemic. UN Secretary General Antonio Guterres and the UN High Commissioner for Human Rights, Michelle Bachelet, have both said that the world is facing a pandemic of human rights abuses. Indigenous peoples, women, people marginalized by race, caste, and disability have been particularly vulnerable to human rights abuses, from housing to medical access to threats to their physical person. Indigenous communities and human rights defenders have faced threats, arrests, displacement, and assassination during the COVID pandemic. This is true also of emerging democracy protests and protests for racial justice around the world, including the United States, and people have been silenced in the face of dissent. In the Amazon, indigenous communities face threats to their territory and physical well-being from both mining companies and illegal miners. The Amazon is an area that has been particularly hit hard by COVID with high infection rates, due in part to poor access to healthcare and outsiders such as mining workers entering the area and bringing disease. Amazonian leaders and other prominent figures recently participated in an online gathering to call attention to the multiple pandemics facing the Amazonian people. We see hope in this Easter season with the vaccine access increasing, but we also see that the poorest countries may not have access to a vaccine until 2023 to 2024. One of the barriers to access is equity. We see that the top 10 richest countries own 75% of the total vaccine doses, and this is becoming a phenomenon that's being called vaccine apartheid. We also see how often it is the richest people and politically connected people who are accessing the vaccine within countries before even essential workers. We also see the emergence of something called vaccine diplomacy. For instance, just recently, President Biden worked out a deal with Mexico to give them a portion of their promised vaccine, AstraZeneca, in exchange for helping with the border crisis. And likewise, there was a recent deal between Japan, the United States, Australia, and India to produce up to 1 billion vaccine doses from Johnson & Johnson. And this is in part to counter the influence of China in the region. And additionally, China and Russia are also producing their own vaccines and also likely will come with influence in those countries in which they are sharing those vaccines. So it feeds into the same kind of mentality where it's an us versus them in this global race for vaccines and influence on the global stage. Another barrier to overcome for vaccine access is vaccine hesitancy. And we know that some people are concerned about the safety of vaccines, and we encourage people to talk with their doctors and read up on the recent science to see the safety and efficacy of these vaccines. And we also know that for some populations, there's a lot of skepticism due to historical injustices. For African Americans, the history of racist medical experiments and treatment conducted on African Americans creates hesitancy among some. Likewise, In developing countries, there's also some vaccine hesitancy due to the distrust of the United States and the West. One of the most recent examples is the CIA's fake hepatitis B vaccination campaign in Pakistan in the early 2010s, where vaccine workers collected DNA data to find Osama bin Laden, which proved not successful. And now there is great distrust of other vaccines, such as for polio and COVID in Pakistan. Some Catholics are hesitant to get the vaccine from a moral perspective. The Vatican says that although some vaccines were developed through testing on cell lines from 2 aborted fetuses in the last century, that the moral responsibility is very remote for vaccine recipients, especially when they may not have access to which option of the vaccine they get. And Pope Francis calls for every person to get vaccinated for the common good. A coalition of Catholic organizations in the United States launched today on World Health Day to call for people to get vaccinated as an act of charity and solidarity. They call for vaccine equity across the United States and the world. Our office, along with the Maryknoll Fathers and Brothers, Sisters, and lay missioners. Another barrier to vaccine access is price. South Africa paid almost double what the European Union paid for the AstraZeneca vaccine. Some countries have banded together to increase purchasing power for lower prices, such as the case of the African Union and the European Union. This is not the case in Latin America, which has taken a country-by-country approach and making affordability uneven across the region. Another barrier to vaccine access is production. There is not enough vaccine, even though the tools to mass produce the vaccine exist. Governments, pharmaceutical companies, and institutions must use all the tools at their disposal to produce as much vaccine as possible and to make it affordable and in fact free to recipients and accessible to all. The current efforts and tools are insufficient. Right now, the World Health Organization COVAX facility is the main facility to provide vaccine to developing countries, especially the least developed countries and the least able to afford it. The COVID-19 Vaccine Global Access Initiative promises 2 billion vaccine doses to developing countries by the end of 2021. Even if COVAX could obtain these vaccines, that amount would cover doses for just 20% of the population of all participating countries. They are encouraging wealthy countries to donate surplus vaccines to developing countries in need of the vaccine. COVAX just announced that shipments of AstraZeneca's vaccine will be delayed for at least a month. With a surge in cases in India, India has halted all exports of vaccines in order to vaccinate their own population to respond to this surge. A year ago, when China and India went into lockdowns, it also affected the global supply chain of generic drugs, since they produce the building blocks for many of them. Another barrier to vaccine access is intellectual property protections. Those include for the vaccine recipe, for the technology to produce the vaccine, as well as the ingredients that go into the vaccine. And if a country or a company were to try to produce these vaccines without those patent rights, then they could face trade sanctions and lawsuits that could cost them millions or billions of dollars. And that is why world leaders, developing countries, other prominent people, as well as activists, are calling for a TRIPS waiver at the World Trade Organization in order to access all of these critical components involved in ensuring that there's a vaccine that is effective, affordable, and produced widely enough for people all over the world to have access to it. And there are other means to be able to get access to these patents, but the processes take too long and are truly insufficient given the extent to which patent protections have only increased in the last 2 decades. Now it's not just about what's in the vaccine or in the medicine, it's the technology and the technology know-how to be able to produce it. And for instance, Moderna has offered up the patent for their vaccine, but they won't provide the technology or technological know-how for any generic manufacturer to actually then produce it because it's a totally new way of making a vaccine. And this really comes down to corporate greed. Most companies use taxpayer dollars to develop and produce the vaccines and the technology, or taxpayer dollars from the United Kingdom. This should really be a people's vaccine. Companies plan to increase the prices on the vaccines for successive boosters and say that they will raise prices when the pandemic is over, and could even make decision themselves about when that timeline actually is. And this will only make the vaccine access further out of reach for people in countries least able to afford it. How is the church responding to this global call for vaccine access? In his Easter address just last week, Pope Francis decried spending on weapons for war, while also calling for equitable and affordable vaccines access for all people and investments in economic recovery. The Holy See, as an observer state to the World Trade Organization, also has shown support for this TRIPS waiver. On February 24th, they said that the current mechanisms to reduce IP barriers are slowing down vaccine rollout. They support the waiver, saying it would be a strong signal demonstrating real commitment and engagement, and thus moving from declaration to action in favor of the entire human family. We're also seeing in the United States statements from the U.S. bishops calling for affordable and equitable vaccine access on a global scale. And U.S. faith communities, co-led by the Maryknoll Office for Global Concerns, sent a letter to the Biden administration urging them to support the waiver. What can we do as people of faith to call for global vaccine access? For many months, the U.S. government has been one of the few countries opposing the waiver, but now, due to calls and emails from everyday Americans, they are considering support for it. And Congress is now starting to weigh in as well. And after this call, you have an opportunity to send a letter to your member of Congress asking them to support a letter led by Representative Jan Schakowsky to President Biden, asking for the White House to support the TRIPS waiver at the upcoming WTO meeting at the end of the month. We know that COVID-19 is a global issue. We will all be at risk as long as there are substantial numbers of unvaccinated people with the potential to contract and pass variants that are not yet covered by the vaccines. We cannot let our sisters and brothers, our siblings, continue to get sick and die when the solutions exist. As Pope Francis said in Fratelli Tutti, we are all in the same boat, where one person's problems are the problems of all. As Easter people, people of hope and faith, let us row this boat together to save lives.
Wonderful. Thank you, Chloe. Wow, you raised some really important issues. I'm thinking of Pope Francis's important teaching about the vaccines. And really, it's all about the common good. And that's so helpful. There's been so much controversy and concern and just confusion about them. But also trying to understand about distribution and caring for one another. This is a pandemic. The only way out of it is if we take care of each other, the nature of it in that regard. So it's so complicated with the WTO and the intellectual property rights. So I wanted to ask some questions about that, and we have other questions that people have submitted. Well, first of all, if you were faced with someone who supports the pharmaceutical companies keeping their intellectual property rights and not issuing a waiver for these COVID vaccines and the technology, how would you respond? What would you say?
Well, I hear that, but at the same time, we've already spent millions, billions of taxpayer dollars to give these pharmaceutical industries money to develop these vaccines. So in a sense, we've already paid it forward. And now it's time to make sure that we have equitable access to this vaccine that our tax dollars have already supported. In addition to that, this is a moral issue in that this global pandemic is nobody's fault. You can't say that any one person really caused it, and especially those least able to afford it. And so this really needs to be free for everyone, because we know that we are not going to emerge from this recovery or from this pandemic without the vaccine. And we really need a response that's more like the way we responded to polio versus the AIDS crisis. When the polio vaccine was developed, it was given freely because we understood that we were facing a major crippling pandemic disease of sorts. And then with the AIDS epidemic, we waited years and years and years to get affordable medicines to people. In the meantime, so many lives were lost that didn't need to happen because they couldn't afford the medicines that were available.
Yeah. And the important points you made about job loss, poverty, hunger.
Yes.
Those are all pandemics happening as well. Absolute crisis. Well, what's your opinion? You're the one who's been paying most attention to this upcoming WTO meeting. What do you think is going to happen? Will the United States support a waiver for the intellectual property rights for these vaccines?
Well, I do think that we are in a new moment and that there is some real sea change happening, and that, as people learn more and more about the benefits of this waiver, that there's growing interest in having it happen. And now the Biden administration is actually considering it. The US has blocked it for months and months and months. And even early in Biden's term, the US still wasn't willing to support it. So I think we are in a new moment. And that's why I really encourage all of you after this call to take action and write to your members of Congress and asking them to support that letter led by Jan Schakowsky asking the Biden administration to support this TRIPS waiver. And if you registered today, then you should get it in your email inbox. Otherwise, you can check out our website, our Facebook page, and we will probably have it posted there as well.
Right. Yeah, really important for us to raise our voices and generate the political will on this, because that really is, it's a moral issue and they need to hear from us. So that is on our website. I'll just give a plug for that, www.maryknollogc.org, and you'll see it right there on the front page. There are a couple other questions. Let me scroll through. Well, Chloe, what role do Catholic organizations play on this issue? What's happening right now? I know you mentioned that there's this coalition that Maryknoll's a part of that was launched today. Could you speak about that again?
Yes, this new coalition has gathered to call for vaccine access and vaccine equity as a matter of charity and solidarity, and they are encouraging vaccine equity both on a US as well as a global scale, and encourage faith leaders, Catholic leaders to help overcome any vaccine hesitancy too as part of this campaign. Because again, we know that it's in the interest of the common good that everyone have access to this vaccine.
There was also,
and we'll look in the chat and we should be able to post that link there again so that you all can go and take a look at it yourselves.
Great. There was also a question about the varying prices and how it's more expensive in different countries. Could you speak a little more about that?
There's not a lot of price transparency. I have to say that. There's a new study that came out, and I'm sorry I don't have it off the top of my head right now, that revealed that countries were paying different prices for these vaccines, and the countries themselves didn't know it. They were told, I think it was South Africa was told, well, that's what we were told was like the price by, the based on the tier of development that we are, that's how much we had to pay. Meanwhile, you had the European Union paying half that much. So that hardly seems fair. I think though another aspect of this is as I pointed to earlier, some countries have actually banded together to form like coalitions to be able to then have more purchasing power to get cheaper prices. And so that happened with the EU. African Union also is doing that. But that hasn't happened in Latin America, for instance, where the prices vary quite a bit from place to place.
It needs to be a global coalition, and we need
Yes.
transparency.
Yes.
We know how it's going to end up and who will be left behind. And that's where Maryknoll missioners live and the communities that they're with. So it's important for us to speak up. So I do hope those on today do find the action alert on our website and send a message to your members of Congress, asking them to really speak to President Biden, speak out in support of this waiver for the intellectual property rights so that low-income countries can have access to producing the vaccine, access to the technology required for it, that we're all in this together. As Pope Francis has said, we're all in the same boat, and let's not sink together, right? Let's make it through. Let me see if there's...
I saw one more question in the chat that I think I could respond to. Is anything being done to get the US to give away the extra vaccines that it has bought and does not need without a long wait until all US citizens get vaccinated? That's something that definitely the COVAX facility has been encouraging countries to do. As I mentioned, there's some of this going on is like a way of sort of vaccine diplomacy where, you know, they're using it for some level of interest, you know, with the US giving vaccines to Mexico to help get Mexico to help on the border crisis right now, you know, so that's one way that vaccines are being distributed. But yeah, it is something that advocates are pushing for, as well as developing countries. And again, the UN, WHO, they're all asking developed countries to contribute these vaccines.
Right. And we seem to be entering a new global public health era where everything has changed, sort of the post-COVID world. Let's be honest, this could happen again, just with climate change and the way our food systems are structured, that we need to brace ourselves for more epidemics of various degrees. And that's if we don't get it right now, yeah. I'm sure, right, that's the urgency of the moment.
That is why we need to have a very holistic approach to how we come out of this pandemic. You know, we need the vaccine. We also need to think about how we can rebuild in a way that's climate resilient to make sure that we can avoid future pandemics that can be driven by changes to environmental landscapes, including changes from climate change. It's why we need to be able to make sure that countries aren't facing crushing debt, you know, that it needs to be a very holistic approach that we take to make sure that we are on a better trajectory into the future so that we can learn these lessons of the past and the impacts of inequality and environmental destruction too.
Well, thank you, Chloe. I see that our half hour is up. I want to thank everyone who's joined us today. The recording of this webinar will be available on our YouTube channel, Maryknoll Office for Global Concerns. I hope you can find it and share it with your friends and family and encourage them to take action now before the WTO meeting. Remind me, Chloe, when that meeting's scheduled?
It's scheduled for the end of the month.
Okay. Yeah. So we urgent need to take action now. Thank you so much, everyone, joining us today. And again, our website, maryknollogc.org. We hope you stop by and visit and join us for more webinars in the future. Thank you. Bye-bye.